The early days of a cancer diagnosis for your pet can sometimes feel like a runaway train. Decisions often need to be made quickly as the aspects of an aggressive treatment plan fall into place. I'm Dr. Jennifer Sperry, the Medical Director for Pets Plus Us. In this session, I want to give you the tools that you need to become the most important participant in your pet's cancer care and to maintain control of an often scary situation. When your pet is ill, a diagnosis of cancer can send any pet family reeling. During an emotional and stressful time, you may be inundated with frightening and complex information. You will be asked to make a series of decisions that have impacts on your pet's health, your own emotional well-being, and your finances. This webinar aims to help you advocate for your pet and for yourself as you navigate one of the toughest trials a pet's caretaker can ever face. Cancer is a condition in which normal cells with specific functions, behaviors, and lifespans become abnormal. They begin to behave differently and may exhibit uncontrolled growth and spread and disrupt or displace normal functioning cells. Cancer is not a single disease, but a group of related diseases that all share these characteristics. There are many different types of cancer, and each type behaves differently depending on the tissue it originates from and the specific functional abnormalities involved. When it comes to making decisions about cancer care or having a conversation about cancer, being able to speak the same language as your veterinarian is important. So knowledge of cancer terminology really is power. Neoplasia refers to the uncontrolled and abnormal growth of cells or tissues in the body. Neoplasms can be malignant or benign. Malignant neoplasms are the ones that have the ability to invade nearby tissues and spread to other parts of the body. Malignant neoplasms are usually the ones that are called cancer. Benign neoplasms are sometimes just called lumps or masses. They don't spread from their original location, but they can still be harmful because of the space that they take up in the body. That's the reason that they may still need to be treated or removed. Metastasis refers to the process by which cancer cells spread from their original location and start to affect other parts of the body. There are some cancer cells that release substances that disrupt normal body functions and affect sites that are distant from the tumor. These effects are called paraneoplastic effects, and they refer to the changes in the body that happen because of a tumor, but maybe not right directly at the location of the tumor. When we talk about prognosis, we're talking about the expected outcome or the expected course of the disease. This includes things like survival time and expected survival time with and without various treatments, the potential for a remission or a cure of a particular cancer, and the expected quality of life that can be considered with a particular diagnosis. Some cancers carry a very negative prognosis with a high risk of growing, spreading, or interfering with the normal processes of the body. These cancers have a higher risk of causing serious illness or death. We often recommend more aggressive treatment approaches for high-risk types of cancers. But there are other cancers that have better prognoses. They have milder impacts on the body and a more limited spread. These cancers are often treated with less aggressive methods and can sometimes be cured. Because there are many different types of cancer, understanding the cells and tissues affected and the genetic mutations involved and the spreading behaviors going on in any individual patient helps doctors to design a treatment plan and communicate the likely outcome or prognosis to the pet parents. Diagnostics or testing is another area where knowing some of the terminology can really help you to navigate the landscape. If your vet is talking about pathology or histopathology, they're talking about a microscopic examination of cells to confirm that cancer is the process going on and to understand the cancer type. When they refer to staging, they're talking about a set of tests that are performed specifically to determine the extent of cancer in the body and the degree of spread. Grading is another microscopic examination. It's when we look at cells under the microscope to determine how aggressively the cancer cells are multiplying and to assign a grade that is either high, related to quickly multiplying and spreading cells, or low, relating to slowly multiplying cells. High-grade tumors sound quite scary, and they may grow and spread faster, but sometimes they also respond better to treatment compared to low-grade tumors. If your vet is talking about sequencing, immunohistochemistry, or molecular tests, they're talking about advanced tests that tell us more about the characteristics of the pet's unique cancer, especially from a genetic perspective. This gives us information about the prognosis and about what therapies the cancer might be susceptible to. Modern cancer treatments are tailored specifically to each patient's unique disease and their unique needs. Primary treatments focus on the actual cancer itself. Primary treatments are things like removing masses, slowing or stopping abnormal cell growth, and alleviating pain and other symptoms that are directly related to the cancer. Secondary treatments are designed to avoid or reduce treatment side effects and meet the patient's nutritional needs. Treatment itself comes with another set of terminology that you should understand. When your veterinarian is talking about treating your pet's cancer with surgery or excision, they're talking about physically removing all or part of a patient's cancerous tissue in an operation. When they're referring to radiation, they're talking about using high-energy rays to kill cancer cells or to shrink tumors. Radiation is often used in areas where surgery is not possible or not ideal. Chemotherapy is the use of drugs to kill or stop the growth of cancer cells. Many chemotherapies have a lot of side effects because they are equally affecting healthy tissues as well as the cancerous cells. Immunotherapy, on the other hand, is the use of drugs or biological products that stimulate the immune system to specifically recognize and fight cancer cells. Precision medicine, or targeted therapy, is the use of advanced and specific drugs to identify and attack cancer cells while sparing the normal and healthy cells, and this can reduce the adverse effects of treatment. There is a predictable cascade of events that occurs when cancer is first suspected in a pet. From the first moment that a lump or other abnormality is discovered or your pet's cancer is suspected, your veterinarian will likely recommend a biopsy. A biopsy can help to determine what kinds of cells are present in the tumor and if they're cancerous or not. This is the first step in understanding if your pet has cancer and what the specific diagnosis is. Once cancer is confirmed, a series of other tests may be performed to grade, stage, and characterize the cancer, as described earlier. With this additional information available, your veterinarians can give you an idea of how serious the condition is and what the likelihood of survival with various types of treatment will be. It will allow them to recommend a treatment plan that may involve surgery, radiation, chemotherapy, immunotherapy, and other tools. They will design a monitoring plan that will help you to understand how your pet is responding to therapy and if changes need to be made to the plan. Here's the deal. The doctors in these scenarios know what to do to gather information, to build a treatment plan, and to get the best possible outcome in terms of survival time. But they don't know about your pet's true personality and non-health needs. They don't know about your relationship with your pet, your personal beliefs around cancer treatment and animal welfare. They don't know about your family responsibilities, your budget, your time, or your availability to travel. There are other important considerations surrounding a pet's treatment beyond survival time. So you will find that you will have to advocate for the information that you need and the diagnostic and therapeutic plan that will best suit the needs of your pet and your family. I want to give you an example. A golden retriever was diagnosed with T-cell lymphoma. In humans, a common and effective treatment for this type of cancer is a bone marrow transplant. This is something that can be offered to dogs at a single facility in North America. Treatment involves strict isolation of the pet for 2 weeks to prevent infection, long duration travel to a facility in the United States, many invasive tests, procedures, and rechecks, and fees approaching $100,000. Just because this treatment is available does not mean that it is appropriate for every patient and every family. I happen to know that the family involved in this scenario has limited cash availability, they don't have a passport for international travel, they can't take extended time away from work or family responsibilities, and the particular patient suffers from severe separation anxiety and would experience considerable distress through the isolation period. All of these factors make this treatment inappropriate for this patient, and all of these factors are likely to be unknown to the veterinary care team recommending the treatment. So clear communication and advocacy is absolutely essential in this situation in order to arrive at the best treatment plan for this unique pet. When a cancer diagnosis arrives, it may feel like you have to make decisions and act immediately, but there's always time to talk. First, talk to your family and clarify your priorities. How do you feel about cancer treatment yourself? How might your personal experiences and beliefs impact the kind of therapy that you want to pursue for your pet? What level of side effects are acceptable or unacceptable for you? What quality of life must your pet maintain in order for you to want to continue with treatment? And what amount of time can you commit to therapy? You may also have to think about things like whether or not you can travel for specialized care if it's necessary, and what your budget is for treatment. Realize that your veterinary team may not know your priorities. Based on their past experiences with other pet families, they may make assumptions that influence what information and options they share with you. For example, they may assume that you want to pursue the most aggressive treatment approach, so they may present the gold standard treatment to you, and they may fail to give you more conservative options. Or they may assume that you have financial barriers and fail to share with you the most costly options. Avoid these miscommunications by using one powerful sentence. I want you to know that I may have practical or financial barriers or personal values that could impact the path that we will choose here. However, I want to be provided with the full range of information and options available before I make a decision. This is the most important part of this whole presentation. You can skip the rest if you like. This clear statement will ensure that you are provided with everything that you need to make an informed decision. Some people are hesitant to share their limitations because they fear being judged by the veterinary team. Please be assured that every day, veterinary teams encounter clients and pets from all walks of life. No matter what option they present first, you should know that they are very versatile and very accustomed to adjusting treatment plans to a variety of needs. When you are open with them, they will be able to help you to find a path that leads to the best possible outcome for you and your pet's circumstances. As I mentioned earlier, when cancer is first suspected, a variety of diagnostic tests are necessary to determine the type and the extent of the cancer. When diagnostic tests are recommended, ask what the results of each test will tell you. For example, a biopsy will tell you what type of cells are involved and if the lesion is benign or malignant, and what the specific cancer diagnosis is. This gives you the earliest insights about your pet's prognosis. General tests like blood screening, x-rays, and ultrasounds can give you information about what organs may be affected and how far the disease has spread. Molecular tests and other advanced diagnostics can give you information about what genetic mutations are responsible for the cancer and what drugs may be the most effective for treating the condition. Some tests are more invasive than others. Some tests are more valuable than others, and some tests are more expensive than others. Whenever a test is recommended, ask your veterinarian how the results of the test might influence your pet's treatment protocol. Revisit your own values and priorities and ask yourself how the outcome of the test might influence your decision making. It is up to you if a test is performed on your pet or not. But if you are considering foregoing a test, ask your veterinarian how that might influence your pet's treatment and outcome. If the results of a test aren't likely to give you a lot of new information, or if they won't change how your pet is treated, it is completely reasonable to skip the test. When considering treatment options, it's important to know that there is rarely only one option for care. Similarly, there is rarely just one drug or just one procedure involved in a complete treatment plan. Different treatments have different abilities to impact your pet's outcome and different influences on their well-being as they go through treatment. Your goals for your pet are especially important to consider when choosing a treatment plan. For any treatment offered, here are a few questions you should be asking. First, how likely is this treatment to improve my pet's length or quality of life? What are the potential adverse effects of this treatment? How long do they last? And what can be done to minimize them? What is the time commitment required for this treatment? Specifically, what is my time commitment required? Does this treatment require travel to a specialist, or hospitalization, or separation from my pet, or frequent visits to the veterinary hospital? How might this treatment impact other members of my family, such as children, pregnant people, elderly members of the family, or immunosuppressed people, or even other pets? Some types of treatment result in the release of toxic products into your home environment that may impact other people in the home, and you need to be aware of how to handle this and if it's appropriate for your particular home. Finally, it is also very important for many people to ask how much a treatment will cost. The answers to these questions are important so that you can decide which treatments you want to advocate for and which ones you may want to advocate against. Again, it's fair to ask your veterinarian, how might foregoing a treatment influence my pet's outcome? It's important to establish your quality of life benchmarks for your pet early and to communicate them with your care team. In the late stages of an emotional battle with your pet's cancer, it can get harder to make decisions about stopping treatment, starting palliative care, or even electing euthanasia. It can also be hard to start this conversation with your vet after the two of you have worked so hard together with your pet. Sharing your quality of life goals with your vet early can help make decisions about transitioning to end-of-life care a lot easier. Early in your journey, work with your veterinarian to record your imperatives related to quality of life. The core elements for quality of life include signs of pain and their response to pain control, and these can be seen as things like their posture, their limping, any vocalization, or any reactions to touch. Also important are appetite and hydration. You want to know what your cutoffs are related to their interest in food or water, their ability to maintain their weight, and whether or not they are experiencing digestive issues. Mobility and functionality is also important. This can be seen as comfortable movement, the ability to stand, lay down, self-groom, and toilet, as well as expressions of general independence through mobility. Your pet's breathing and respiration should be easy. If they're experiencing effort or discomfort in breathing, or if they aren't able to relax, this is an important factor in your decision making. Cognition, behavior, and engagement are also very important. Pets that are isolating or that are not socially interacting as they normally would are potentially experiencing a decline in their quality of life. They should be able to enjoy attention and socialization, and they shouldn't be experiencing too much anxiety, confusion, distress, or restlessness. And when treatments are offered for these problems, they should be able to respond to those treatments. Many vets can provide a numerical quality of life scale that can help you to make decisions about your pet's overall comfort and well-being. The final thing that an advocating pet parent can do is explore support networks. You are not alone. Many other pet parents have been on this journey before you. So reach out to support networks where you can find them so that you can learn from the experiences of others. By hearing their stories, you may be able to anticipate, understand, and normalize the intense feelings that you may encounter as you care for your pet. You can learn about the successes and the challenges that they've faced and find out about the resources that they've used to help support their emotional and financial well-being throughout a cancer battle. With knowledge, goal setting, communication, and cooperation with your veterinary team, you can become an empowered pet parent. You have the power and the choice to make decisions that best support your pet's cancer care and well-being, ensuring the needs of your entire family are considered. Working closely with your veterinary team, you can find a path forward that aligns with your values and provides the best possible quality of life for your beloved companion. Thank you for joining me today.